Having a stuffy nose, cough, and nasal congestion from allergies, a sinus infection, or from other medical issues can greatly affect your quality of life. This video provides important information about sinus rinsing. Sinus rinsing is an effective self-care technique that you can do at home to help with your symptoms. This video addresses what is sinus congestion, the benefits of sinus rinsing, and how to do sinus rinsing at home. The sinuses are air-filled spaces in the cheekbones, between the eyes, and in the forehead. Normally, the sinuses are moist or wet inside with a thin layer of mucus. Normal, healthy sinuses have fine hairs or cilia inside to clear the mucus. It drains away on its own. When your sinuses aren't working as they should, the mucus builds up. This is called congestion. Congestion usually means that the lining of the sinuses is swollen. You may have thick, colored mucus drainage, bad breath, fever, facial pressure or pain, a cough, stuffy nose, or all of these symptoms. Rinsing the inside of your nose with a mild saltwater solution helps to reduce the swelling. This, in turn, often reduces congestion to help you breathe more easily. Rinsing also moves mucus, dirt, and dust out of your nose and sinuses. Rinsing the inside of the nose is known as sinus rinsing, sinus irrigation, or sinus lavage. Sinus rinsing is a technique you can learn to do at home. Sinus rinsing is a proactive step you can take to help relieve sinus symptoms and congestion. Here are the steps to do sinus rinsing. Step 1. Gather your supplies. You will need a sinus rinsing device and materials to make a mild saltwater solution. This is also known as saline solution. There are different devices to use for sinus rinsing. The most common are a sinus rinse bottle. As you squeeze the bottle, the saline squirts out the top. Or a Neti pot, which looks like a small teapot. You can get a sinus rinse bottle or Neti pot at your local drugstore or a store that carries home healthcare supplies. A bulb syringe should not be used for sinus rinsing unless your healthcare provider tells you to use one. Saline solution is the most common fluid to use for sinus rinsing. Saline is a mixture of salt, baking soda, and very clean water. Distilled water is the best option. No matter where you live, tap water or well water are not completely clean or pure for purposes of sinus rinsing. You don't want germs in the water to go into your nose. If you must use tap water, boil it for 3 minutes and then cool. Use water that is warm or body temperature. It is more comfortable. You can warm the water in a microwave. Don't use hot water. For the saline ingredients, you can buy pre-measured packets of saline powder over the counter. You can also make it yourself. If you make saline at home, start with 1/2 teaspoon of salt and 1/4 teaspoon of baking soda in 8 ounces of distilled water. Use non-iodized sea salt or kosher salt and not table salt. The non-iodized salt will be more comfortable. Adjust the amount of salt to your comfort. Step 2. Wash your hands very well with soap and water. Rinse and dry your hands on a clean towel. Step 3. Prepare the saline solution. Fill the sinus rinse bottle with the warm distilled water. Add the saline powder to the bottle. Screw on the nozzle. Gently shake the bottle to mix the solution. For a Neti pot, Stir the saline powder into the water and mix gently. If you are measuring your own salt and baking soda to make saline, add both to the bottle or neti pot and mix gently. Step 4. Start rinsing. Lean your upper body over a sink. You may prefer to keep your face upright as if you are looking into a mirror. Or you may want to tip your head toward the faucet. Put the tip of the bottle firmly into one of your nostrils. You want to block the entire nostril. Gently squeeze the bottle until the solution runs out of your other nostril or your mouth. Before you release each squeeze, remove the bottle from your nose. You don't want to pull solution that was in your nose back into the bottle. Use about half the bottle for each nostril. If you are having trouble, try putting your head in different positions to see what works for you. For a neti pot, follow the same steps. Tip your head to the side. Put the tip of the neti pot firmly into one nostril. Pour the saline into the nostril so it runs out of your other nostril or your mouth. Do one side and then the other. Step 5. After rinsing, tilt your head to the side and blow your nose. Some saline may drain down your throat. The small amount you swallow is not a problem for most people. Step 6. Clean the bottle. When you have finished rinsing, wash the bottle or neti pot with hot but not boiling water and a small amount of dishwashing soap. Rinse and drain well. Allow to air dry. Wash your hands and dry on a clean towel. Replace the bottle every 3 months. As you start with sinus rinsing, you may have to try different saline powders to see which one works best for you. And don't give up. Sinus rinsing may seem hard at first, but it is an important part of your self-care, and it makes a difference for many people. Your Mayo Clinic healthcare team is here to help answer all of your questions as you manage your symptoms from allergies, chronic sinus infection, or from other medical issues.